So let's look at the case again now. Let's look at the shape of the teeth. We know that the shape of the teeth and the shape of the face of the patient has got something to match to. An inverted face of the patient is approximately the shape of the central incisor. And we know there is a problem with the shape of the tooth as well in this particular case. And you can see the four anterior crowns. We also see that the rest of the teeth are a little hypoplastic. We see that the abating effect is not very good. That means you show more of the first molar than the premolars, and you also see that there is dissimilar gingival exposure on the left and the right side, right in the front and the back. So this is the case, and we have a challenge of how to plan the case. However, because we are going to redo those crowns, it's very, very important that we check two things. The incisal display at rest. So when you check the incisal display at rest, what are you seeing? You are seeing about 6 millimeters of display at rest. Is that aesthetic? And the answer is no. How much should you show? Maybe 1 to 2 millimeters. That means the crown height can actually be reduced. We don't need for aesthetic purposes, but we need to confirm this with our occlusion as well. And the idea here is ask the patient to move her lower jaw in the front and look at the posterior disclusion on both sides. Now, on end-to-end relationship, if the posterior disclusion is very high, by reducing the incisal edges, what's happening to the disclusion is what you need to gauge.